Assalamu Alaikum, dear viewers. I am Professor Dr. SMA Erfan, a colorectal surgeon. Today I am here to speak with you about a disease of the anal canal. For many years, I have been working to create public awareness about diseases of the anal canal. Through writing in newspapers, appearing on television programs, and through social media platforms like YouTube and Facebook, people are gradually learning about these diseases in an easy-to-understand manner. In many cases, they are avoiding incorrect treatments. 5 to 7 years ago, many patients with conditions like piles went to practitioners who advertised with signboards in various places. They would go to them for treatment, putting their lives at risk and developing numerous complications. Some even developed cancer. Now, however, people are gradually becoming more aware. They are going to qualified doctors instead, especially colorectal surgeons. This is a significant accomplishment. Through my ongoing awareness programs, we have made this positive shift. Today we will discuss the anal disease, fistula, and its various treatments. In our previous session, we talked about the common operation for fistula, which is fistulotomy. Today we will talk about other treatment options. One of these treatments is the lift procedure, which stands for ligation of intersphincteric fistula tract. This method is used for complex or high anal fistulas that cannot be treated with fistulotomy, as the fistulotomy would require cutting the anal sphincter, leading to incontinence. In the lift procedure, an incision is made in the anal canal to enter the space and identify the fistula tract. The opening of the tract is then closed off and the fistula heals over time. This is an effective operation, but I no longer perform it. I used to, but now I perform laser treatment for all types of fistulas, no matter how complex, and I am achieving excellent results. We will discuss that in the next session. Another widely popular method is the Seton procedure. This involves inserting a type of surgical thread through the fistula tract, especially for high or complex fistulas. The Seton creates an inflammatory reaction, and in the case of a cutting Seton, it gradually cuts through the tissue. The tissue behind it heals as it cuts. There is also a draining Seton, which helps drain pus from inside the tract. Draining the pus is important because a fistula will not heal if pus remains. However, the Seton method has its challenges. It is a very long process and the thread remains in the anal canal for an extended period. This can be very irritating for the patient and maintaining hygiene is difficult. Additionally, pain is often a factor. Despite its drawbacks, the Seton method is used worldwide as it avoids damaging the anal sphincter, which is a risk with cutting operations. There are other unconventional methods, such as injecting a glue-like substance or using an endoscope to clean the tract. However, these methods have not been successful, are expensive, and I do not recommend them. Inshallah, in the next session, we will discuss laser treatment for fistula, which is the method I now perform with great success. Thank you all. Stay well, stay healthy, and stay with us.